Welcome to Pedo Teeth Talk, brought to you by the American Academy of Pediatric Dentistry, a podcast show that delivers cutting-edge ideas for the professionals specializing in pediatric dentistry.
Thank you for tuning in to Pedo Teeth Talk, where we bring you the contemporary issues important to you and your practice. Brought to you by the American Academy of Pediatric Dentistry. I'm your host, Joel Berg. We're here today with Teresa Duncan. With over 20 years healthcare experience, Teresa addresses topics such as insurance coding, office manager training, and patient conversations. Her memberships include the National Speakers Association and the National Association of Dental Plans. She has been named one of the top 25 women in dentistry and is the author of Moving Your Patients to Yes, Easy Insurance Conversations, as well as contributing author to the ADA's annual CDT Companion Guides. Her podcast, Nobody Told Me That, provides regular coding and management updates. Teresa received her master's degree in healthcare management. Teresa, thank you so much for being here today and sharing your expertise with us.
It's a pleasure. Thank you for having me.
So, Teresa, in the middle of this COVID-19 pandemic and in general, we're learning a lot more about teledentistry, and it's something I'm very interested in. Our listeners are very interested in. So to start out, tell us what teledentistry means. How do you define teledentistry?
There's a few ways to define it, but at its core, it's talking with your patients and connecting with your patients via non-traditional in-person means. So you can do it via video, you can do it with audio, there are certainly many apps and programs out there that can facilitate that, but it's really being able to take care of your patients or at least put them at ease via non-traditional methods.
So when you talk about software, that's out there, are you seeing the development of software specifically for teledentistry as opposed to telemedicine? I've seen a few things. Maybe you could talk about that for a minute.
Sure. There are apps made or programs made specifically for teledentistry, and it is really exciting to see them grow because it feels like teledentistry has moved forward at least 10 years because of this COVID. I'm certainly not excited about COVID, but it really has put the spotlight on teledentistry. There are lots of apps out there already that have proven track records. There are many that are coming to market because of this demand. So my concerns when I choose a program is what is its HIPAA capabilities and making sure that you're compliant with that, and what are the documentation capabilities, because at the end of the day, my goal is to have you not get sued. I mean, that really is my goal with coding and with management. So just make sure it's HIPAA compliant, make sure it's easy to use on the patient side, because it might be very easy for you, but if it's not easy for the patient, it's not going to happen. So easy on the patient side and very easy to document. Those are my three criteria.
That's great. And I think, in this time where rules are being relaxed in many states, and I want to talk about that later, to allow teledentistry in the moment, as you said, we should take heed to make sure that we're not causing another problem, to make sure at least it's compliant in the ways you describe. So what is, notwithstanding the COVID-19 pandemic and the crisis we're in, what is driving teledentistry in general? Prior to this, if you go back to December of last year, teledentistry was already, on the move. What's been driving the interest in teledentistry in general?
So it's part patient acquisition via, non-conventional means. It's been really a marketing tool for many dentists successfully. And then the other side of it is collaboration between the providers. So you have specialists collaborating with either hospitals or other dental specialists. So it's been very successful in that way. It's been sort of a little niche industry, and it's starting to blow up. But radiologists have been using this for a long time. That radiology is its own dental specialty, and there have been many offices that take the CAT scans or the CBCT scans, and are not comfortable reading them. So sending them to the radiologist is really one of the best first uses that we've seen of teledentistry.
Are you seeing these, back to the technology, and I'm sure we'll talk about that a lot, are you seeing connectivity between the software that manages teledentistry and the electronic health records that exist in the offices?
The electronic health records in dentistry still have a long ways to go for being part of a total electronic health record. So the app or program that you use, many of them offer recordings, audio recordings. Video recordings are still optional, and according to the state law, whether or not you have, the double-sided ability to record. The audio recording, however, it seems like you could just attach the file and that would be complete with the electronic health record. But I've been told by several companies, actually several teledentistry companies, that transcript has to be put into the file. So not only are you recording it, but you have to, make a transcript of the call, and that is what should be entered in the electronic health record. The good news is there's many apps online that will transcribe it easily because they're computer programs.
So electronically transcribe, like our voice recognition software does for us.
Yes, absolutely.
So how you're connected with the broad dental community. So how are you seeing providers utilizing teledentistry in this national emergency we're in?
Well, our first role, of course, is to keep our patients out of the ER if they don't need to go there. And we all know that our patients go to the ER for dental emergencies much more than they need to. So keeping them out to avoid any contamination or spread of the virus is paramount. Now, the other part of it is we have a lot of uncompleted treatment that happened right when this all went down. So I'm not meaning emergency treatments. Those are still, of course, you need to see your patients if it's a true emergency. But perhaps we were in the middle of a long treatment plan. We did scaling and root planing, and then we have something else that we want to do. I love being able to connect with my patients and say, how is everything doing? Is everything okay? Do you have any questions? And making sure that they follow up on their home care. So there's a lot of uses for it other than just, using it as a marketing lead. And being able to connect with your patients and allay their fears is very important right now.
Yes.
When we're in pain, we kind of know. When we have mouth pain, we know whether or not it's something that we need to go and talk to our colleague about. For patients, any little pain is an emergency for them because they just don't know what it means. So
right.
Fear is a big thing right now everywhere.
Right, and it's even bleeding, a small amount of bleeding, which might be gingivitis or periodontitis, which needs to be managed, but not today, could be perceived as an emergency. Mm-hmm. Yeah, so are these software, again, back to the software, because I want to talk to our audience about how this will be used. Do they enable the use of smartphones to take intraoral photographs that, where the doctor can see what's going on in addition to talking to the patient?
Yes. So many of them do utilize your phone feature, and there's also ones that allow you to do video calls that are HIPAA compliant. So the ADA has published a guide on teledentistry, and it gives you specific examples of the apps not to use, which are the public-facing apps like Facebook Live or TikTok or Snapchat. Any of those you're not supposed to use for teledentistry. The ones that are behind a wall are what you want to go for. But I'm very nervous telling you to use a publicly available app for a purpose such as this, just because I don't know the legalities, and my goal is to keep you out of jail, right? So right. I would rather use a program that is specific for that, and they can all utilize your phone. Many of them are just a downloadable app for the patient to use, which makes it super easy.
So I don't think TikTok is HIPAA compliant, I would guess, for example.
TikTok is a lot of things, and I would say not HIPAA compliant.
Yes. So it's rhetorical, but I'm assuming this is going to be a boost for teledentistry, which was already on the way, and now we're going to be using it more. So how will I use this post-COVID? You already have alluded to it, but maybe a few examples, and I want to ask you about as well.
Sure. So first of all, I want to address that there's some skeptical providers out there, and rightly so. Anytime a new modality is introduced, you're not sure of it, you need to do your due diligence. But it has been around long enough for me to recommend it and be completely behind it. So, but if it's not for you and you don't feel like it's going to work in your office, then don't force it. It is what it is. You don't have to use every laser or every, new machine that comes out. So this may not be for you. If you do like it, there are many uses after COVID, post-COVID. So this is pre-COVID and post-COVID. So many of the providers are using them for their regular clear aligner checks so that they don't have to actually use chair time. Because, let's face it, we sit them in the chair, take a look at them and say, okay, yeah, here's the next set of aligners. That can all be done remotely, and you can either mail them the aligners or they can just swing by the office and pick it up. Mm-hmm. So you also have patients who are very busy travelers can't get in there, but they want to have your opinion. So that's another way to get in touch with them. You know, some people are now discovering that they grind their teeth a lot because of all the stress. I mean, that's something that you could discuss with them. And I want to be clear, it's not a true diagnosis. That's not the end of the line. Teledentistry is more of a triage, and that's how I would look at it. It's more of a triage for you to find out if they need to come in and do, have a more complete evaluation. There's also the marketing side of it. So, and I also want to talk about the customer service side, but the marketing side of it, there are many specialists out there who use this as a click here to request a consult via Skype. One of the offices in my area, they had taken one of my classes. I had talked about it, and they came up afterwards and were really excited. And they said, go to our website, because we actually allow them to choose if they want to have a Skype conversation before they come in. And they said it's been popular. Their patients are so excited when they come in because they're like, oh, it's so good to finally meet you. I mean, that sounds great to me.
It sounds wonderful. Yeah. I would like that with my physician and my other providers. Yeah,
absolutely. So let's talk about the customer service side for just a second. You know, I am in the admin world. I live and breathe the admin world. From an admin point of view, I could certainly use it to go over, bills with my patients. If they have a question, I could always do dial up, share my screen. You know, that's not necessarily teledentistry. This is just using another way to communicate. For my post checks, why wouldn't I, instead of calling, because nobody answers their phone, why wouldn't I ask if I could do a check-in with them via, FaceTime or whatever it is that you're using, whatever app that you're using, and just check in with them. Now, there are some people that aren't going to love that. That's okay. But I'm thinking of my son, who's 19. I'm thinking of my little cousins who are in their 20s. They would love a FaceTime with their provider. That's all they do.
Yeah, that's a great service. There's no doubt.
Yeah. So I think it's a good marketing tool. And, it's still got that kind of cool wow factor. It's not going to make you a ton of money. It's not going to make you a ton of money. But I think it's just another way to make it easier for our patients to connect with us.
One different area, you and I were talking about this as we were prepping for our podcast today, that we used to, in many academic health centers, the residents in pediatric dentistry will look after patients in the newborn nursery. And with the millions of births each year, what certain percentage, 10 or 15% or more, have a soft tissue lesion or a tooth at birth, a natal or neonatal tooth. Don't know what to do with it. Does this baby need to be seen? So we thought of the idea of using teledentistry, training nurses to place the intraoral camera, and then we could make assessments of need to be seen or not. Does that sound like an example that we could be doing going forward?
I think that's such a good textbook example, honestly. As my son was in the NICU when he was first born. So if there was something I could not ask my dentist to come in just for that one visit, I would probably have snapped a picture and sent it to them. So to have an intraoral camera where the nurse has been trained to take exactly the correct pictures, I mean, honestly, you can guide the patient through it, but having a nurse trained on it is perfect. That avoids contact, and especially during COVID, you don't want to go into the hospital for that. And
right.
Yeah. So I think it's a great use and application of it.
Yeah. So regarding training, should all team members in the dental team be trained? And, how do you see them using the technology?
I would love for all team members to be trained on every new modality. Of course, if you're placing implants, I don't mean placing implants, but at least be familiar with the technology so you can talk about it accurately. So if the doctor is saying, I can check in with you virtually if that's what you want, and then they go up front and the receptionist is like, oh, well, can you do that? I didn't even know about that. So that just makes us sound like we're on the same page. We have to have training. And as I said, the admin team, I think, is going to find a lot of good uses for this. So I do want everybody to be trained. I want them to know the benefits. I want them to know the technology, so everybody is, able to provide it should they need to.
So let's talk about something else on everyone's mind, and that's compensation. Can we expect to be compensated? And as a preface to that, I saw in my state of Arizona, the governor issued a declaration about a week and a half ago that dental teledentistry must be able to be reimbursed at the same level that it would be in the office, along with other health care.
So I always expect to be reimbursed. Sometimes I'm disappointed, right? So it depends on the state. Now, many of the carriers have made statements that they will reimburse at a 140 level, which is your limited evaluation level. So the codes for teledentistry have been very interesting because you would expect them to be tied to compensation, but the carriers really see those codes, the D9995 and 996, they really see those as descriptors, not reimbursable codes. So it does need to be accompanied by an evaluation code in order for you to receive any compensation. Now, in your notes, you need to make sure that you have something alluding to the fact that it is an emergency, or you risk, not getting compensated for it should you need to appeal it. So you're not going to get a lot of money. It's not going to be, it's not going to be a line item on your profit and loss statement for sure, but it is going to lead to more solid relationships with your patients. Now, what I have been hearing often is, well, I've done this before. Why am I suddenly charging for it? And this is where, sometimes this hits providers well and sometimes it doesn't. So I apologize if you're in the latter group, but I do expect that you should be compensated for everything that you do. I mean, the cost of dentistry now more than ever is being evaluated, and we do in our industry give away a lot for free. And I have never been a fan of free because I'm so used to collecting the co-payments and all of that. But I do, if you think of it this way, if I had to take a look at that situation in the mouth that you were saying in the hospital, I could charge you $25 for 5 minutes, but it would not be a qualified, opinion or anything like that.
Right.
You went to school and you did all the work, so you can do this in 5 minutes. I want you to be compensated for that knowledge. It's only right.
Right, and I think it's consistent with the trend in dentistry that I like to talk about, and that's medical management of caries. And because most of our revenue is based on restorative, specific procedural things, surgical things, if you will, the profession as a whole, notwithstanding the coding and the teledentistry, is not used to getting compensated for giving advice.
Yes.
And so I think it's really going to push that side together with teledentistry, because if you compare us to physicians, primary care docs mainly get compensated for giving advice. Or for, listening and then giving a comment of what your risk level is and what to do. So this really fits into that genre too, don't you think?
I do. And the medical industry seems to prepare our patients for that type of conversation. So I'm thinking to my medical coverage, I have a virtual visit with my doctor scheduled for next week, and I expect him to charge me for it because I've received the warning from the receptionist, and I also know that my plan covers it. So for the providers, the dental providers, you should know that most of the medical plans are urging their patients to utilize telemedicine. They were doing this before COVID because the cost of a screening is much less, of course, than a cost of an in-person visit. So many of your patients, I would say the majority of them with healthcare benefits, have been asked to use telemedicine. So when you ask them to use teledentistry, this is not going to be something like, they're not going to think, oh gosh, what a money grab. They're going to think, oh, okay, that's how my medical doctor does it.
Right. They're used to it.
Yeah. It's don't be afraid of that conversation because they've heard of it before. And if you have to explain what it is, explain what it is. Why be nervous about that? It's a service, a legitimate service.
Yeah. So how likely are patients to accept this and use it?
Well, right now, they're very happy to accept it and use it. If somebody with a cold sore that's never had one before, they're freaking out. They don't know what it is. So yes. I think they're very nervous, and they'll be happy to accept it. And I think like I said before, there's going to be a whole generation that will be thrilled to use this kind of service. So I don't think patients are the problem, to be honest with you. I think it's our industry just getting used to a new way of talking to patients. And, from the clinical side to the admin side, I know a lot of administrators who, their skill is talking to the patient in person, and they're really good at case presentation, at making the patient feel welcome, and they're worried about this. And those skills are going to transfer over to the visual. It's going to be fine.
Wow, this is great information, Teresa, and I think our audience is really going to jump on this. And I just have one last question to kind of tie it together. You mentioned the HIPAA concerns. I think we're all ready to try this, to do this. We need to. What other legal issues might I need to think about?
So state specific. You need to think state specifically before you jump into this. There are some states who have put out guidance. Texas has actually come out and said that, they do not support teledentistry. Their state board, has issued guidance to not do it, which I don't quite understand, to be honest with you. There is one state, I want to say it's either Maine, I think it is Maine. One state had actually been in the process of voting to allow teledentistry, and then the virus hit. So in Maine, it looks like you can't, but it's just because they were in the process of voting to allow it. So that's been interesting. So check with your state society and make sure that you are actually able to do it. Now, HIPAA concerns, that's always going to be a priority, right? Because right now HIPAA is not paying attention, but they will later. So the Office of Civil Rights, who oversees HIPAA, they have issued a statement that they're going to relax the discretion. They're going to use discretion in prosecuting HIPAA violations. They're basically saying, relax, go ahead and do it. This is for the greater good. So I am still nervous about that. So I just don't want you to get in the habit of relaxing, because
we don't know what relax means. Relax can mean a lot of things.
Right. You don't want to be the test case for that grumpy inspector that wakes up and hasn't had good coffee, right? You don't want to be that test case. So just, make sure you do your due diligence, ask
Stay away
your
from
friends.
TikTok.
Yes, please. For so many reasons, right? So,
right.
But yes, just make sure that you're doing everything legally, and please document. Make sure you mention that it's an emergency in these times. And, I think you're going to find that you're really going to like it.
Yeah, I think so too. One last thing is, I was thinking, we're talking about third-party payments, the federal payments, Medicaid, which is a big part of pediatric dentistry. My understanding is they've been looking at this longer and earlier, and for the most part, they will compensate, notwithstanding the state regulations.
Yes, I believe California has been compensating for, rural health services. Yeah, one thing that I think has been interesting, and I was just speaking to somebody who's involved in this, is the public health aspect for the nursing homes. Because right now, no provider can go into the nursing homes.
Right.
And then, so teledentistry is a perfect use there. It's already been in use there, but for right now, it's more paramount than ever. So I know there's been conversation at the federal level to include that into the Medicare package. And for those of you that aren't health policy nerds like I am, once Medicare starts to provide reimbursement on a regular level for something, it tends to trickle down to the rest of the carriers. So,
yes.
If you have any elderly, I know this is a pediatric podcast, but we all have elderly patients that we know, and maybe moms and dads in this situation.
Right.
This is a perfect use also. It's interesting you brought up the right at birth, and now we're talking about, the elderly. That's a perfect application in both situations.
Yeah, no, I agree, and I'm going to follow up with you on that one, Teresa. That's a very interesting subject and close to all of our hearts. We're a community of dentistry, and we're all in this together.
Absolutely.
Well, Teresa, thank you so much for being with us today. I really appreciate you giving us a lot of great information.
My pleasure.
And thank you for tuning into Pedo Teeth Talk, where we bring you the contemporary issues important to you and your practice, brought to you by the American Academy of Pediatric Dentistry. We'll see you here next time.
Pedo Teeth Talk is brought to you by the American Academy of Pediatric Dentistry, the show that delivers cutting-edge ideas for the professional specializing in pediatric dentistry. If you have any questions or comments, please email info@aapd.org. We welcome your ideas for future shows and guests. For more information on the American Academy of Pediatric Dentistry, visit aapd.org.